I tell my patients that what we're doing with Proleukin is using a medicine which they have already in their body.
Proleukin is a biologic therapy, and that is in contradistinction to chemotherapy. Chemotherapy tends to break down the cells and destroy the cells directly.
What Proleukin does, it helps a patient use their body to fight the cancer. So unlike conventional chemotherapy, where you're using a chemical synthesized in the outside and inject into the body, this is using a molecule which stimulates your own body to rise up and fight on your behalf. Because of that, it's a very powerful thing.
Interleukin-2 gives patients the opportunity for long-term remission, 10, 15 years out. And I think that's the single greatest advantage of interleukin-2.
In our center, we treat patients that are eligible to receive interleukin-2 based treatments early on. It's usually our first line of treatment for younger patients and patients that fit the criteria to be treated with this drug.
For patients who we are considering for interleukin-2, we want to make sure that they have good organ function so that they are able to tolerate high-dose interleukin-2. And the things that we look at are cardiac function, pulmonary function, kidney function, liver function, and the absence of other significant comorbid illnesses such as inflammatory bowel disease or infections.
We've treated patients who've been as young as 18 or as old as 77.
If they do not respond to interleukin-2, the fact that they were treated that way does not make them less likely to respond to other forms of treatment.
Typical treatment process for interleukin-2 is an inpatient treatment. Patients are usually have 2 6-day hospitalizations separated by about 9 days.
Patients typically come into the hospital and they receive a dose of Proleukin every 8 hours for up to 14 doses at a time. So that typically amounts to about 5 days of treatment.
So we walk through the whole litany of potentially serious side effects, the things that bother me, the doctor, or any kind of cardiac or respiratory problems. The things that bother the patients are usually things like itching, sometimes diarrhea, sometimes insomnia, sometimes just feeling weak. And all of this reverses itself at the end of the week when the treatment is completed. So if it's possible, I also have them speak with another patient who is going through the treatment. And I think that does a great deal in providing a comfort level for people when they're really talking about something they have no experience with.
At about 6 to 7 weeks from the time of starting therapy, therefore, you will have an idea of whether or not there was a response to the high-dose Proleukin therapy. And of those people who are going to respond, 90% of them will achieve a response after that first course of therapy.
It may not work, it may not be what they choose, but nevertheless it's something they have to consider because it does have the possibility in a small percentage of patients to produce meaningful long-term responses and disease-free survival. So for those patients, they need to get the correct information. They don't need to be fearful of the information, they need to get the information.
One of the most powerful things about IL-2 is that in those patients who have had a complete and durable response, it's nothing short of a second chance of life. The words are long-term durable responses, right? That's it. Long-term durable responses. And it means that you basically have a situation where the tumor shrunk down and it stays that way for a very, very long time.
Patients with renal cell cancer and melanoma need to understand that they have limited options and that Proleukin is a major option for them.